Hello, my name is Dr. Karen Hoving. I'm a clinical psychotherapist near Denver in southeast Aurora, Colorado. If you're watching this video right now, you may be considering going into therapy. And I know that that's a really huge decision for many people. Even making that first phone call to a therapist can be daunting at the very least. And you may be one of those people that is still struggling with, do I need therapy? I have a lot of friends, a good support system. Is therapy really something that I need right now? And what's the difference between therapy and talking to a really good friend? What is psychotherapy? Therapy is a very special conversation that takes place between you and your therapist. Now, there are a lot of you that may be thinking, why would I need therapy? I have a very good friend that I can tell all my problems to. Well, there are two key things that make therapy more beneficial than talking to your friend. The first is, in our relationship, during our 50-minute clinical hour, I am 100% focused on you. At no time do you have to worry about sharing the time or asking me how my day was or checking in with me about my family or friends or things that are going on with my job. We spend the entire time talking about you, the issues in your life, and what's going on. The second thing that makes it very different than a relationship with a friend is confidentiality. Once you become a patient with me, I can't release any information about you to anyone. That means I can't even acknowledge that you're a patient. I can't discuss your situation or your name or any of the things going on in your life with anyone. Another thing that makes our conversation very special and different than one with a friend is that I use a lot of creative techniques to help you get in touch with your feelings and let go of the ones that have been holding you back. One of those techniques is journaling. Now, a lot of you may have kept a journal or a diary as a child, and it is something like that. But oftentimes I'll give you special assignments or things that I want you to work on during the time between sessions. And usually what I do is, in the first appointment, is I actually give you a journal so that way you don't have to go out and buy one or forget to buy one. First time you call me, you should probably get a pretty good indication of what I'm like to work with. I'm basically fairly extroverted, and I tend to participate a lot during the sessions. Now, if you're looking for a therapist that will be very quiet, take a lot of notes, and just sort of look at you and say, how does that make you feel? Then I'm probably not the therapist for you, because I do tend to be very involved in what's going on in the session. The most important thing in choosing a therapist is making sure that you click with that therapist, making sure that you feel comfortable, since you're going to be sharing a lot of intimate information with them. So make sure you choose someone that you really click with. Most research has shown that it's very important for you to have a good relationship with your therapist. As a matter of fact, a lot of research has shown that that relationship is responsible for a lot of the healing that takes place during therapy. Thank you for taking the time to watch this video. I hope it has given you an idea of what I'm like. If you want more information, I encourage you to call me.